President, the organizers of the Arctic Circle, thank you for bringing the circle to Nuuk. For the organizers of this forum, thank you for bringing this item, mental health and well-being, on the agenda. Local capacity with people, family, and local community can strengthen health and mental well-being in the Arctic. A few words about myself due to this presentation. I'm working in the U-Arctic thematic network with health and well-being, member of ICC's Circumpolar Inuit Health Committee, working at the Greenland Center of Health at the University of Greenland, sitting in the board of Greenland Institute of Natural Resources, and especially for 25 years have been a part of the municipality board of family welfare, where we give together with school and social system, get advice in cases of child abuse and child mistreated to the politician. As mentioned in the other presentation, health indicators for indigenous people are the indicators we see here in Greenland are the same as we see in all indigenous people all over the world. Then infant mortality, life expectancy, infectious diseases, high suicide rate, substance abuse cause significant health problem, cardiovascular diseases, diabetes and cancer increase, domestic violence, etc. If we have to look at that problem, there are some keywords which we have to work with. Capacity building in the north, training in community, cultural connection, and rapid transition. When we are seeing the list of the problems with indigenous people, we have to focus on some important things when we are looking at that. Indigenous people define and understand the circumstance surrounding their life in terms of multifactorial process rather than taking problem-specific approach, which we often do in the Western health system. You cannot get or demand a cultural, competent healthcare system from the government in South. The only way is to build it yourself. If we are looking at some of the cultural values and compare between indigenous and Western way of looking at it, harmony with nature, domination of nature, soul and body united, soul and body are divided, feeling are important, feeling must be rationalized, education from elders, education from professionals, leaders serve the people, people serve the leaders. To be is more than to have is more than to be. To see it in another way, to look at health promotion and health prevention, how we try to solve a lot of problem in our society is try to prevent, focus on risk to identify, diminish or eliminate risk, focus on the result, focus on expertise, focus on survival, passive participation, do what I tell you, one-way communication, top-down. If we are looking at in a health promotion strategy, focus on resources, mobilizing resources, focus on the process, focus on advice, focus on life quality, active participation, two-way communication, and bottom-up strategy. Here's a picture from the General Assembly of ICC in Inuvik and the representative of Inuit Circumpolar Council Health Committee with representation from all the 4 Arctic Inuit countries. From the ICC health strategy, I have headline, family values and the health and wellness of children and youth are the priorities. Individuals must take responsibility for their own health. Family must take responsibility for ensuring the health and wellness of their children, and communities must take ownership over responses to emerging crises and rely less on external support. Health promotion strategy is important to fulfill this goal. To focus on the family perspective. The family has always been the basis for the childhood. It is necessary to maintain the family perspective in a community in transition. Priority needs to be given over the next decade to ensuring that children grow up in families and the community services are available for childcare, development, and training. Here's my family. We have good and bad experience as all other families. Some in the pictures are dead, but still living in our heart. We have the capacity in our family to take the responsibility for solving the problems for our family members, and we try to take this responsibility. One important thing for family is food, a bed to sleep in, and a work for the parents. Going from to the society, but not leaving the family. For all families in Greenland, the self-government, recognizing that the people of Greenland is a people according to international law with the right of self-determination, own language, common responsibility, solidarity, and equality. That's important for all families in Greenland. To see it in another way, health promotion, cultural and personal feelings, self-definition of health and good life, feeling capable of taking care of own life, identified resources and way of action. The goal is mobilizing energy to handle everyday life and stress situation. Process is needed in some key area. Infrastructure, self-determination of health service, access to a network of community-controlled primary healthcare service. Education has been mentioned many times, but education on all levels is important. Greenland Center for Health Research at the University in Greenland are preparing PhD courses where 50 PhD students during 4 courses the last 5 years have been with research communication, health society and environment in relation to large-scale industrial projects, research method and epidemiology in small population, ethics in small population. We have also planned a master courses. And health education of health professional is also important to get a cultural-based health system. And the medical doctors here in Greenland, we need 100 medical doctors, and here you can see we have 32 medical students from Greenland at the university in Denmark, and 26 physicians have training contracts. And I will sum up with the last thing, family health responsibility, resilience, capacity building through Arctic research and education and through governance. Mining and infrastructure and fishing is important to give the possibility for family to have work. Family values and a place to live and work, capacity for own responsibility is important. Thank you.